How's it going, ladies? You doing all right?
Rebecca Mabe's job might require her to carry a gun, but this Union Pines High student resource officer, she wants her students to know that her most powerful weapon
What are you worried about?
is her ability to listen.
They want to be heard.
Yes.
What do they want to say?
That they're lonely, that they're sad, that they want things to get back to normal. They want to be able to have their friends and their school family and be able to come here day in and day out and learn and grow and be safe.
North Carolina Public Schools hoping to amplify those voices statewide through the Say Something Anonymous reporting system, the flagship program from Sandy Hook Promise, the organization founded by the grieving parents of the 2012 massacre in Newtown, Connecticut. Here's how it works. Submit a tip via the app, a website, or phone call. They all go to the same place. Crisis counselors on the other end answering in real time 24/7, even continuing the conversation. At the same time, those counselors chatting with a designated point team at each school, usually the SRO, a nurse, or other faculty.
We had a student that reached out about another student that was just saying that they couldn't do it anymore and that they were in their own way saying goodbye, to several different friends. When that student felt the only answer they were getting was the goodbye, they immediately reached out through the app to let us know that something was going on and that they needed somebody to get there fast to help him.
Did that tip save his life?
Yes, I feel like it did. And it opened his eyes to the fact that he wasn't alone, that he had people that cared about him. I just told him, I said, I hope you're feeling the love. I'm here at 1 o'clock in the morning. I'm here for you.
In the middle of the night.
Absolutely.
This tip came in at night, at the middle of the night.
Absolutely. And most of the ones we get are late at night.
An ABC 11 I-Team investigation also finding that in this COVID-19 pandemic, most of the tips coming through are also more urgent. Sandy Hook Promise reporting a 77% increase in the rate of life safety tips in North Carolina since March 2020. A life safety tip is a designation from counselors that at least one life is in imminent danger. The top 5 tips coming through: bullying, cutting or self-harm, suicide, depression, and drug use. Across the country, the I-Team uncovering data showing the trends consistent and even worse. Schools using the app in Houston and the New York area, a 44% increase in the rate of life safety tips. Across Pennsylvania, another state using the system statewide, 118%. San Francisco, where many schools have yet to open, a 144% surge in the rate of life safety tips. Altogether, a national average of a 133% spike in how often a counselor considers a student's life is in imminent danger.
I'm an eternal optimist, and I have to say I'm actually very nervous about this year's return to school.
Nicole Hockley is the co-founder of Sandy Hook Promise. Her son Dylan, killed at Sandy Hook, today would be a teenager.
I think during COVID, most schools have been fantastic about figuring out how to stop the spread of COVID within their schools through physical measures of distancing, masks, barriers, plexiglass. I don't think enough attention has been given to mental health support for kids.
Hockley also warning that many tips now might be going underreported without friends being around each other to recognize a red flag.
Talk to your kid. Talk to them. Don't just leave them in their room or in their basement on the computer looking at their schoolwork. Work alongside them. Be connected and communicate with them regularly. Be that trusted adult for your child.
I'm used to walking in hallways where there's always kids.
For Officer Mabe, she's eager to be that trusted adult too, and she won't let a mask hide her smile when the halls are bustling again.
Through your eyes, through your words, through your actions.
Y'all have a good one. It's good to see you.
There are now nearly 500,000 students in North Carolina and counting trained to use this Say Something Anonymous reporting system. Our coverage continuing online. You can watch our full interviews with the SROs and Sandy Hook Promise, learn the warning signs, the red flags to recognize. Plus, go behind the scenes into the crisis center and learn more about this amazing system helping protect our children. It's on our website. Check out this story, abc11.com. Jonah Kaplan, ABC 11 Eyewitness News. Even the cutest paint job can't make an emergency room that hospitable. It's just not the place any family wants to be for broken bones or broken souls. Dr. Angela Strain, a mother herself, always trying her best to make everyone feel better.
The kids will say they're sad. They'll say that they're worried.
The kids may soon be known as the COVID-19 generation, which is ironic since few will have actually contracted the disease.
You're an emergency physician. You work here at a big hospital system. You're seeing all these patients, and none of them have COVID.
Right.
But they're still suffering.
Yeah, absolutely. There's definitely a lot of secondary effects of the pandemic that people who are losing their jobs and losing their homes and their families are disrupted.
1 year into the pandemic, we're learning more about the impact of that disruption. The I-Team digging into the data of pediatric emergency room visits for behavioral health issues at the Triangle's 3 major hospital systems, Wake Med, Duke, and UNC. The trends are remarkably consistent. The actual number of visits steady, maybe even a little lower than the last few years. The length of those visits, the severity of those cases, the rate of hospitalizations, those are the metrics all showing significant surges. At Wake Med, case managers telling us patients range from age 5 to 17. Some don't have any prior history of mental health conditions.
We see a lot of kids feeling worthless because they're gaining significant amounts of weight, which is understandable if you're stuck in the house doing virtual learning, right? And their parents echo the same thing.
For children and teens with pre-existing conditions, some parents and guardians, they're the ones coming for help.
We knew that patients and families were struggling to be able to take off time from work and school to make it to those appointments. We knew that they were concerned about stigma and confidentiality.
At any ER, beds, not to mention a doctor's time and attention, always at a premium, which is why many providers also going virtual to reach patients where they are. Still, as schools come back, experts warning that transition will also be stressful. So this spring and summer, sunshine might actually be the best medicine.
Getting sunlight, fresh air, physical activity.
Be a kid.
Yeah, absolutely.
Jonah Kaplan, ABC 11 Eyewitness News. Ve'asu li mikdash ve'shachanti betocham, and let them make me a sanctuary that I may dwell among them. It's a verse etched in the book of Exodus. But where in the Bible are there contingency plans for a global pandemic?
How do you tell the congregation that we're going to honor the words of the governor and not meet on Sunday?
Raleigh pastor Joe Stevenson, learning long ago from his grandmother. Sundays in a black church are soul-enriching experiences.
She reached her hands over my shoulders, positioned my fingers on the keys, key of F. I'm learning how to play Jesus Keep Me Near the Cross by ear. And that's when that started, and that's how I began to release some of those tensions that I might have been harboring, although I didn't know that's what they were until later.
Your spirit will show up and show out.
Particularly in the black church context, the African-American context, the church is, and I really believe will always be, the place where those matters are worked out.
This here is their therapy.
This is their therapy. This is their hope. This is where they get their healing.
The tragic irony of the COVID-19 pandemic, though, is that people were forced to stay at home, away from their jobs, away from church, all while family and friends grieve for lost loved ones who died from the disease, not to mention having to nurse old wounds of racial strife.
I believe that some are hurting silently alone.
It's not just that they sit at home. They project it maybe on their children.
Sure, transference happens.
On their spouses.
Yes.
In their jobs.
And themselves.
The feeling may also be fear, the notion that a personal problem can't be prayed away. Yes, external factors like foundational racism and a lack of access to affordable health care do matter. But that alone cannot fully explain why federal studies show nearly 70% of minorities with a mental illness won't receive any treatment.
Joan, if you broke your arm, you wouldn't just stand there and pray. You would pray and head to the emergency room at the same time.
Toshiba Rice, a pastor in Wilson, saying her calling is to preach to the preachers. And so far, she's gotten more than 100 religious leaders from across the country to sign up for her training on prayer and mental health.
When we don't seek the supports that we need, it does hold you back because it doesn't allow you to excel. This is the a turning point, a great exodus for the faith community to work together with merging mental health and their faith and letting people know that this is a place where we can recover and recover well through resilience.
Pastor Joe Stevenson among those in Pastor Rice's virtual pews and eager to deliver this new homily. For God to dwell among us, we must treat our sense of self like our sanctuary.
I think it's a core value.
Jonah Kaplan, ABC 11, Eyewitness News.